Living Well, brought to you by CHRISTUS Cabrini Hospital.
Becky Watkins joins us today. She is Education Coordinator at CHRISTUS Cabrini Hospital, and we want to talk about what happens to people when we really have those rainy days, when the sun doesn't come out. It affects our moods.
There's a type of depression, it's called seasonal affective disorder, and it usually hits in late fall and then goes on through the winter, and then once the days get longer, it resolves itself in the spring.
Okay.
But many times people have to get treatment for it. The symptoms, I guess, are hopelessness, a sense of hopelessness, eating too much and weight gain, whereas other depressions you eat too little, sleeping too much, and other depressions you sleep too little. So there are some hallmarks to this type of depression that are unique.
Okay, and we do have it in this area. I know it's much greater in other areas of the country.
Oh, absolutely, we have it. I have people, friends of mine, who say, I dread the winter days, you know, because they're so short and there's a lot of darkness. And if you have that feeling that winter is closing in, and usually you start getting it in September, you start getting that feeling. Alaska, that has no light whatsoever in the winter, they have all darkness. That's the state with the highest percentage of depression and suicide.
Okay.
Whereas Florida, that has the most sunshine, has the least depression and suicide.
Who does it strike? What age group?
It can start in the teens. It can start with people who are teenage years and then continue on into adulthood.
Okay.
And so if you wonder if you have it, it'd be good to check that out with a professional.
And you check that out with your doctor. And certainly if you have a family member that you are recognizing some of these symptoms.
I would check it out. Light therapy works, and you can buy a light box online, and you sit in front of it for 30 minutes in the morning to stimulate certain pituitary gland functions. But I would go ahead and see someone to help you out with that, and just do the normal things like eating a really healthy diet and getting enough sleep but not too much sleep, and getting some exercise, the things we tell everyone who's going through any kind of depression.
And so again, it's called what? So
It's
if folks
called
want to go
SAD.
on the computer and find out more information.
SAD is seasonal affective disorder.
Great.
And
Thanks.
if you look that up on the computer, you're going to have multiple things.
For more information, call 866-581-3627.